Thank you for coming to our NSA Research Blitz. We are joined by 6 researchers who will be presenting their NSA funded projects. Thank you all for taking the time to be here tonight and to celebrate National Stuttering Awareness Week. Angela will now tell you more about these awards.
Thank you, Courtney. Thank you so much, everybody, for being here with us this afternoon. It's great to see so many familiar faces. I first want to thank the Professional Development Committee of the NSA for putting this together and showcasing some of the fruits of the research committee's labor. So thank you for doing that. We're going to be showcasing awardees of 3 of our different funding opportunities tonight. So our first round of presenters were funded by the Graduate Student Research Award. And this award's really cool because it really shows the NSA's investment in our future, because we want to start supporting researchers as early as possible. So this award is designed to support students or graduate students in their research endeavors. This award is a $5,000 award, and it's been supported these past couple of years in memory of Diane Games. Tonight, we're going to have Dr. Cody Dew. He's going to be presenting his funded research first, followed by Haley Warner. So without further ado, I turn it to you, Cody.
Awesome, great. So I will go ahead and share my screen here. There it is. Okay. So I am really honored to be going first today and just get a chance to talk about my research and even how impactful the award has been for me. So yeah, I received the award in 2023 when I was a doctoral candidate at Binghamton University. I was in a interprofessional PhD program called Community Research and Action. So as the name implies, it really focused on how to do research with your community, and then how to apply your research to make actionable change with the people that you work with. And it's led, I mean, because of this award and that it funded my dissertation project, it led me to finishing and now being Dr. Dew and having a position as an assistant professor at Binghamton University. So I was told to provide a quick timeline. So this is kind of where I've been with the project and then where I'm going with it. I was really excited that I got to present my initial findings at the World Stuttering and Cluttering Organizations Conference back in May. And then I successfully defended my dissertation just back in December. There's been a few, I wouldn't call them setbacks, but delays. My wife and I welcomed our second child back in November. So things moved slowly at times, but now things are really picking back up, and I'm really at the point now where I'm turning the project into research papers to publish and share with SLPs and other professionals. But I'm also really looking, to disseminate this work where people who stutter can hear it. Which also reminds me, I didn't put in the timeline that I was also able to present at the NSA conference over the summer as well. yeah, so let's get into the actual research project. And my whole goal of the project was to help inform people who stutter and their allies about evidence-based, well, really to develop evidence-based strategies for navigating the labor force. And when I say labor force, I'm not just talking about applying and interviewing for a job or working at a job. I'm really talking about um, the this really broad idea of what it means to be a participant in the labor force. And it really starts at this idea of career conceptualization, which if you dig into the literature on like career development theory, it could start as early as like 5 years old, right? When you're in kindergarten and your teacher asks you, what do you want to be when you grow up? All the way through high school, and then figuring out, do I need to go to college to get this job that I want? Do I need to pursue a trade school? So it really starts there, and it never stops. You're as you're working, right? You're continuing to navigate your career. You're pursuing promotions, um, and I'm sure we can all start to think about how people who stutter are affected during these key stages of labor force participation. And yes, there's a lot of research that's been done, and it really starts with knowing that verbal communication is among the highest desirable traits of an employee. So you have that, but then we have these stereotypes about stuttering, right? That stuttering equates with being a poor communicator. So from there, all these other things happen. People who stutter are feeling that they're entrapped to only certain roles, roles that tend to require low communication demands. Reporting feeling overlooked during interviews, feeling limited in their ability to achieve at work and to perform their duties, as well as some, discrimination, increased anxiety and vigilance at work. So all of these studies have contributed to understanding the experience. But what was really lacking is, well, what's the answer? Like, how do we then navigate these experiences? And that was the question that I wanted to explore in my research. And so really I asked two questions, but I asked these questions of different groups. So I asked people who stutter to reflect on their work experience, and then to also share with me how they successfully navigated those experiences. And then I also wanted to explore that same question with SLPs who have clinical expertise in stuttering, who have seen tens, hundreds, maybe even close to 1,000 clients who stutter, and get their feedback on what were their clients' experiences and what do they see as successful navigation strategies. So, in talking with everyone, there seems to be four main themes of experiences. And the biggest one, the one that came up the most, and the one that seemed most impactful were these internal experiences. How the person who stutters themselves experienced their stuttering at work, felt about their stuttering at work. Feeling uncertain if they should apply for that job or if they should go for that promotion. And then really this idea of vigilance that's also been explored in the past, just really anticipating those negative reactions and looking for them. The people I spoke with, both adults who stutter and SLPs, talked a lot about positive experiences that they had from coworkers or supervisors having positive reactions to their stuttering, or even being supportive and intervening when a coworker says something that they probably shouldn't have, or encouraging them, to do that work presentation, or to go to that conference. Another very common theme that came up were these equivocal experiences. And I call it that because most of the time, the reactions of coworkers or bosses were well-intended, but ultimately unhelpful for the person who stutters, as well as some of those subtextual statements, things that could be interpreted one way or the other. The one that commonly came up, being, "Oh, did you forget your name?" Something like that. Very hurtful and offensive, but from their perspective, probably just trying to make a bad joke. And of course, there also were adverse experiences that came up. Everything from encountering barriers to, direct hostility. And from this, I was able to develop an essential structure of experiences. And really what this picture shows you, those adverse experiences were the lowest occurring. And every experience from a positive, equivocal, adverse, those all really influence the internal experiences. And the internal experiences had the biggest impact on the adults who stutter that I spoke with. So from that, then, you have to talk about experiences before you start talking about navigation. And there were three key navigation strategies. And because that internal experiences was the biggest, navigating oneself and trying to change your mindset around stuttering, around what you're capable of, developing your work skills, developing your communication skills, and just stuttering openly and without fear. Those were really important things for navigating these negative experiences. Being proactive about how you navigate. So establishing connections with coworkers that you could lean on. Again, being open about your stuttering and disclosing it to your coworkers or your supervisor. And then it was also really important to be reactive when something comes up that offended you or that was preventing you from engaging in your work duties appropriately. So advocating for yourself and finding some way to take action. And so here is the essential structure of evidence-based strategies that people who stutter can use. And again, it really starts with that self-navigation piece, figuring out how you can reframe stuttering for yourself and even maybe think about it as an asset for you. And then once you have that down, that's when you're then able to engage in the proactive and reactive navigation. And of course, my time is very limited. If you want to read my dissertation, it is like 200 pages long. But I wanted to just highlight this one quote here that I think really sums up what navigation looks like. And it's that this one participant saying that I made my workplace stutter friendly? And I think that's really important because most people don't know about stuttering. And so I think that whether, we can talk about whether it's a good thing or a bad thing, if the responsibility lies on the person who stutters. But I think, where we are right now, it's really important for that individual to to proactively look at and strategize to see how they can make their environment stutter friendly. And I'm not sure if questions are now or at the end.
We'll take questions at the end.
Awesome.
Okay. All right, so you should just be able to see my slides, hopefully. Yes, thank you. Okay, my name's Haley Warner. I'm the 2024 NSA Graduate Student Research Award recipient. Thank you again. And I'm a doctoral student at NYU, and this award is supporting my ongoing dissertation work that's titled, "Does the Awareness of a Listener Impact Stuttering in Early Childhood?" I received the award last summer, and so since then I've started data collection. However, it's still ongoing. I've collected and analyzed 4 participants thus far, and I'll talk a bit about those 4 participants at the end of this presentation. To provide some background on the project, I'm sure that many of you on the call know that stuttering is highly variable in the sense that people stutter on some words and in some situations, but not on all words and in all situations. Yet this variability is not entirely understood, which is really a barrier in advancing stuttering research that can ultimately inform therapy and supports for people who stutter. Even though stuttering is variable, it's not totally random. So for example, there's some evidence that the awareness of a listener may contribute to the variability or the likelihood of stuttering events. And some of this evidence comes from anecdotal reports that people don't stutter when they're by themselves, which is sometimes referred to as the talk alone effect. And that tells us there's something about this social communication between the speaker and the listener that seems to trigger stuttering. So a few years ago, we sought to test the talk alone effect in a laboratory setting using something called private speech, which is speech without the perception of a listener. It's essentially just talking to yourself out loud. Like, for example, if you were in a grocery store and you said your grocery list out loud so that you would remember what you need to buy, there might be people around the store, but it's considered private speech because you're not actually communicating to a listener. You're just saying something to yourself. And we found that adults don't stutter during private speech, again, indicating that something about this awareness of a listener may be necessary for stuttering events to occur. Despite this interesting finding, there's no studies that have examined how the listener impacts children who stutter, which led me to my project that I'll talk about today. Because testing children near the onset of stuttering events, in this case preschoolers, provides insights into core features of stuttering versus things that may change or develop over time. Preschoolers also provide the unique opportunity to explore the skills involved with listener awareness as it's starting to develop. In the same age range that stuttering tends to develop in 3 to 5-year-olds, it's also this rich age for development of these processes that we use when we're talking to someone. So for example, reading facial expressions or just thinking about what our listener is thinking of us.
And the umbrella term for these skills that develop at this time is often referred to as theory of mind, which is just the ability to separate one's thoughts and beliefs from the thoughts and beliefs in others. So it's the understanding that I can have a thought that's separate from someone else's, and typically develops when kids are about 3 to 5 years old. So the study uses private speech and theory of mind to explore whether the speaker's awareness of the listener is necessary for stuttering events to occur. I have 2 aims. The first is to determine whether stuttering events occur during private speech from preschoolers who stutter. And we predict, like the adult study, that preschoolers will not stutter during private speech. Again, because private speech is lacking this awareness of the listener, this communication and pressure that comes along with communicating with the listener. The second aim is to examine the relationship between theory of mind and the frequency of stuttering events in preschoolers who stutter. And we predict that preschoolers with a more developed theory of mind will stutter more during social speech. And social speech is just typical speech or non-private speech, so regular speech when you're talking to someone. And we predict this because if preschoolers have this more developed theory of mind, they have more capacity for thinking of a listener, being aware of a listener, that may be more likely to trigger stuttering events. A bit about the project methods. We're going to collect data from 25 preschoolers who stutter, ages 3 to 5. They'll all have a diagnosis of stuttering from either an SLP or a caregiver. They'll exhibit at least 3 stutter-like disfluencies during a spontaneous speech sample. And they'll have a negative history of additional hearing, speech, language, and neurological disorders, of course, aside from stuttering. So what does this project look like? It includes 2 visits to the participant's home. They're each about an hour, and they're recorded with a small inconspicuous video camera. Each visit includes a natural speech sample at the beginning and the end, as well as a Lego task to elicit both private and social speech. I'll speak about that on the next slide. The visits include 3 theory of mind tasks. I'll talk more about that in a minute as well as standard speech and language testing, including stuttering assessments. So how do we elicit private speech? Private speech is actually super common for kids to use. If you have kids or you've spent a lot of time with them, you might notice that they talk to themselves while they're playing or while they're by themselves, and that's considered private speech. Specifically for this study, we're using a Lego task that's been previously shown to elicit private speech, where the child is shown a Lego structure like the one on the screen, and they're asked to replicate the structure by themselves while I distance myself and not engage with them, so that the speech, what they say, is considered private speech. They're just talking to themselves as they're building this Lego structure. Then after they're done building it, we build another similar structure together. And the point of that is to elicit social speech that's similar to the private speech they just said, because we know that certain types of words are more likely to be stuttered than others. So that acts as a sort of control for the 2. For testing theory of mind, we're using 3 standard theory of mind tasks: the Sally Ann false belief task, an unexpected contents task, an effective perspective taking task. Essentially, all these tasks just look at if kids have the ability to separate their thoughts from the thoughts of others. So do they understand I can think one thing and someone else can think something else? We're also using a standardized measure that the caregivers complete about the kids. So this measure includes 60 statements that assessed their child's theory of mind. For example, my child understands whether someone hurts another on purpose or by accident, and then the parent rates between definitely not and definitely if this is true about their child. We're analyzing at least 150 syllables from each of the speech samples, 4% syllables stuttered. And then for determining what is private speech during the Lego task, we are using standardized coding that marks whether speech is considered private. And that is speech that's indicated by the lack of a name or pronoun, gaze at another person, an intentional physical touch of another person, or turn taking. So essentially the child is talking to themselves. They're not trying to get someone else's attention with a name or by looking at them, etc. So I'm going to share a bit of our pilot results regarding the private speech aim. I'm not going to talk about the theory of mind findings yet, because there's very little that we can say about them at this point. However, I do want to again mention that we've only analyzed 4 participants thus far, so please take this with a large grain of salt. But you can see the initial findings here. If you look along the horizontal x-axis, it's each of the conditions across the 2 visits. So the first 4 conditions are going to be from visit 1. The second 4 bars are going to be from visit 2. And then on the vertical y-axis is stuttering frequency. And really the most important part of this figure are these zeros in the private speech condition. So far we're not seeing that preschoolers stutter during private speech, and they are stuttering in all of the other conditions. Again, this is just based on 4 participants, so please take with a grain of salt. Next steps, as I mentioned, data collection is ongoing. If you know any preschoolers who stutter in the New York area, please get in touch with me. My email's on the screen, haley.warner@nyu.edu. But the next steps are to collect enough data so that we can do statistical tests and determine whether the awareness of a listener is necessary for stuttering events to occur near the onset of stuttering. Here are my references, and that's all. Thank you so much.
Thank you, Haley. Thank you, Dr. Du. We appreciate your presentations. It's really exciting to see all that you've accomplished in these past couple of years of these awards. So thank you for sharing that with us. We're going to be moving on to our next segment. So we'll be talking about the CASE Research Grant. So CASE stands for Community Advocacy, Support, and Education in Stuttering. This award is designed to support researchers who are PhD trained and they're already working in the academic setting. So it's to support their research. We've been offering this award for 5 years now. It's very exciting because it started off as a grassroots effort. We just had some members of the NSA community who are really passionate about research and they wanted to start this fund, and it's been ongoing ever since. So I'm really happy that we're going on year 5 now with this award. So our first speaker will be Dr. Nan Ratner, followed by Dr. John Tetnowski. And after them, we're going to have a presentation by Dr. Naomi Rogers and Dr. Ginger Collins. They actually were the recipients of one of our special awards. We offered it for 2 years only. It was a limited edition opportunity. It was our Advancement in Research for Advancement in Clinical Research Award for Children Who Stutter. So they will be following Dr. John Tetnowski. Dr. Ratner, floor is yours.
Okay, let's see. So we will do, there we go. All right, let's see. Can everybody see me? Okay. So to give background here, and I need to move some of my controls so I can see what's going on. Basically, my award came in 2022. It was to validate recommendations made to parents of children who stutter. It is complete. We have done all the work, and we already have presented multiple conference papers. I'll talk about our findings. We have one AJSLP article that appeared in, depending on early view or regular, it appeared in January of this past year, and we have 2 others ready to submit this week, actually, and other secondary analyses coming. So let me see if I can advance this. Okay, there we go. So what our goal was, and I need to get rid of this control panel, sorry. In a share, that's the problem. So our goal was to take the typical advice that is given to parents of young children who stutter close to onset Things like slow down, take more time between turns, don't speak in such complicated sentences to your child, and subject them to some form of empirical evaluation. In order to do that, what we did is we used archival data from the Illinois Stuttering Research Project with Ehud Yeri and Nikki Ambrose and their colleagues. It is now in Fluency Bank. We spent all of our money, I just want to point this out, all of our money went to pay students to do some work that I'll describe, and they are all extremely grateful for the support that NSA gave. They made some of them aware of NSA in ways they didn't know before. And of course, I am very grateful. Let me say a little bit about the data set and then a little bit about what we did here. So the original data set followed children for a minimum of 3 years post-stuttering onset, multiple visits to the University of Illinois. In the end, there were 53 children who stuttered, of whom 14 were persistently stuttering by the end of the study, and 39 of whom recovered. There were a lot of data, at time one, which was their first evaluation, there were about 20,000 child who stutter utterances to look at, and about 16,000 utterances from the mothers. We decided to confine ourselves to moms just to keep things a bit uniform. And we also looked at children who don't stutter. What happened in this study was sort of interesting. It's old enough that there really wasn't an internet as we know it today. And so parents really didn't have the opportunity to kind of Google what you should do if your child stutters. We're never going to be able to run that study ever again. And so it's really interesting to be able to do this. And so first, parents and kids were recorded talking to one another in uniform play sessions, and only afterwards were the parents given some advice. And all parents were told to slow down their speech rate. All of them were told to increase their turn-taking latencies. They were told to do a few other things that I won't get into right now. What's interesting to me, and to perhaps many of you on the call, is so much of what we know about early stuttering comes from this set of really important articles and this line of research. They never even bothered to transcribe any of the parents' or adults' speech. So we spent all of our time making the audio tapes complete in transcript. We basically had to fill in all of the adult interlocutors. And once we did that, we measured, we looked at what the parents were saying. We made acoustic waveforms to look at rate measures, and we computed basically a gazillion language complexity measures, because that's something that's very interesting to me to sort of see what the parents were doing, both at baseline and at follow-up. We now have data on the 1-year follow-up that I will talk about as I go along. The published data from Ali Godsey, which appeared in January, is only baseline data on speech rate and turn taking. So what we found is that, somewhat surprisingly, maternal speech rate and turn-taking behaviors did not relate in any straightforward way to children stuttering. It didn't relate to the frequency of stuttering. So when parents spoke quickly, their kids' fluency really didn't change one way or the other. And it certainly didn't reflect itself in outcomes. In other words, it wasn't true that parents who spoke more quickly to children had children who did or did not recover from stuttering. And so again, with apologies to this little thing on the side here, what we see are things like the turn-taking latencies. None of these differences were significant. They were basically tied. So we did not sort of see any advantage for how long parents waited after children talked to respond in whether or not they recovered. One of our most surprising findings was that speech rate was actually statistically more rapid to children who recovered from stuttering in this particular cohort, indicating that maternal speech rate really didn't play much of a role in the eventual outcome for the child. We also did what I call concurrent analyses. So in the concurrent analyses, we actually looked to see if speech rate and turn taking were related to fluctuations in the child's fluency at the time. For those of you who are not used to looking at correlations or regression lines, A flat line like this basically says that there's absolutely no relationship between these particular measures and we then also looked, and I've been troubled for a long time about whether or not one should alter the complexity of speech when you talk to a child who stutters, because the complexity of parental language is actually one of the best predictors of how strong a child's language is. And we do have some published literature. Some people argue about it, but in my mind, the evidence is somewhat compelling that children who stutter have slightly depressed language abilities. What we found here and what we did in all of these measures, just to explain, is we computed difference scores. So we expect parents to speak more in a more complex manner than a child does. And so what we did is we computed the difference between how the parent spoke and how the child spoke. And once again, we didn't find any really compelling evidence that simpler language helped children become more fluent. In fact, in a couple of these measures, and I'm just going to highlight them, particularly what's called the Index of Productive Syntax, the statistical advantage went the other way, that children who recovered actually heard more complicated input from their parents than children who did not stop stuttering. And we do have the follow-up data, and the follow-up data are identical in a sense that parents of children who stuttered persistently received, in fact, more demanding language in some respects than children who did not stutter persistently. So I want to do something very fast here to give you sort of a takeaway message. I'm going to drag this over to the other side. I'm going to show another picture here that's not directly related to the work we're doing, but I think will help to interpret it. So we've been doing some reanalyses of the success rates of early interventions for stuttering. And a little bit to my concern, or actually much to my concern, the published recovery rates from many, many trials, well-attested trials of therapies such as Lidcombe or the demands and capacities therapies, studies that involved lots and lots of people. And there's a blank here for a Westmead trial because there were too many dropouts to actually compute anything at the end. Basically, what we're looking at is that the average effect of going in to intervene when children are just past the onset of stuttering is roughly about, it's 70% and change. In other words, when we look back, about 70 some odd percent of children who go through any of these early intervention programs seem to stop stuttering. Well, that's the natural recovery rate as obtained from over 3,000 cases tracked in the Handbook on Stuttering. So when we combine this very large recovery rate that seems identical to advice that we give parents in many early interventions for stuttering, we have some real concerns. I mean, very real concerns for me personally. I've been in this field a long time. That advice that we give parents that does not probably impact outcomes and overemphasizes fluency as the major desired outcome of intervention is probably doing more harm than good. I'll say that bluntly here. And that we really need to amp up our game. I started doing some of this research years ago to look at conditions under which children's fluency fluctuated as a function of what parents were doing at the time. Two things concern me at this point. Number one is nobody else seems to have found it interesting. They're not replicating any of this work. Nobody's doing this kind of work anymore. And the work that I did is being interpreted to suggest that if parents will do certain things, the outcomes will be different, that children will either stop stuttering or continue stuttering. That was never the intent of the original work at all. So I think we need to do more work in this area, but what we're discovering thus far, and we would really love to see more work on this topic prospectively, is that we think that it speaks to at least a pause and a reevaluation of much of the advice that we give to parents of young children who stutter. And I think that's my last slide. And so I will, yep. There we go. And I'll stop my share. So.
Okay, I'll pull mine up then. Thank you, everybody, for being here, and special thanks to the NSA. Can you guys see my slides? Great.
We can see your
this research,
notes, John.
you can see my notes too?
Yeah.
Okay. Oh, I don't care. You can do that. I don't have any notes on there anyways. So I'll just this way. Uh-oh. Now I lost it again. I'm going to leave it this way so I can go through and don't take any more time. I'm going to report on the work that was funded through one of the NSA case studies, and it has to do with the use of virtual reality simulations to promote carryover and transfer skills. And once again, this does come from an NSA case grant, and we've already had 2 papers published from this research. We have 2 more in review, and we're working on 2 more. So it's a very fruitful study. Thank you to the NSA for doing so. I want to talk today about kind of just go back and summarize the uses and potential uses of virtual reality for stuttering interventions, and then to report on some findings of 3 studies that I will report on today that seem to go in order within the time span that I have, and then to consider the impact of these findings on treatment and carryover of stuttering interventions for future use. So when I sit back, and I've been a clinician my entire career, on top of being a researcher and a teacher, and it seems to me that one of the biggest issues with not just stuttering therapy, but any type of therapy is how do we get the skills that are learned in therapy rooms to move over into other situations? And when we're looking at this, if I looked at it myself, no matter what technique was used, there was always this issue of carryover. It extends beyond any technique or any program or any philosophy. And beyond that, there seems to be reports of a lot of relapse. And I'm not sure it's relapse or just the natural fluctuations in stuttering, but I wanted to look at that. And if we look at what people have done, what speech language pathologists have done in terms of carryover, they tend to do things like role playing or little field trips to promote carryovers. And there's problems with every one of them, ranging from the lack of reality to how much time it takes to, go across the street to McDonald's or someplace that have that to order, and all the issues with insurance and safety and even privacy matters that kind of come into play. So my true interest came in this when I bought a new phone many years ago, and they gave me a free VR headset, and I plugged it in and thought, what am I going to do with this? I love roller coasters. I bought myself a 99-cent roller coaster virtual reality application, and I found myself holding onto the chair in the kitchen when I knew I was not really on that roller coaster. So there's a lot of things that are going on. And I just want to tell you a little bit about the story of VR and some advantages. Whether you like him or not, we can really thank Mark Zuckerberg, because what he did with Facebook, now Meta, was he brought it to the rest of us. And what used to cost thousands of dollars, we can buy for ourselves or for our kids or for our clients for really a couple $100. And that really kind of came into play with this. And virtual reality is going on all the time, by the way. I just want to put this picture up here, by the way, because this is the Big 12 basketball championship that I went to go see in Kansas City, except I didn't go see it in Kansas City. I went to go see it in Dallas at a facility which is called COSM. And if any of you live in Los Angeles or Dallas, you need to go to COSM, because I'm not at that game. Okay, you can see in this next picture over here that there's actually people sitting here and drinking. And I thought I was really there, and I found myself clapping and yelling and stuff like that. My wife is poking me, and she says, they can't hear you, but this stuff is going on live, and you think that you're actually there. And once again, I think those are the things that are happening in virtual reality. So if we look back at what has been done with virtual reality, it's really not new technology, but it's been used for different applications with things like flight simulators, teaching people how to fly, or learning different tasks. As a matter of fact, even kids who are on the autism spectrum have been trained to learn STEM subjects in science and math through the use of virtual reality. And even motor exercises. Veterinarians use virtual reality, by the way, to learn to study animal and examinations the first time through. But we've also used it a little bit with stuttering, and it actually goes all the way back to 2006 when one of our colleagues, Shelley Brundage, used virtual reality in an interview setting with people who stutter. And later on, Al Nofjan looked at some adults doing a presentation, and both produced very positive findings. Yet, because of the way things worked at the time, they were all done in laboratory settings. They were only done with adults. And beyond that, people talked just a little bit about how good they felt or what their feelings were, but they didn't validate it through any biological markers. So we sought to do that while also to use this training in the convenience of their homes. So from the past studies, we found out that VR can be a viable means of intervention, but mostly because it can really mimic some real life scenarios. And the reactions to VR vary by setting. And Shelley Brundage actually did this. Things that were difficult in VR are difficult in real life, and vice versa. Things that are easy in one setting tend to go into the VR as well. So I think it shows promise as a therapeutic tool, but once again, it was only done with adults, only done in laboratory settings, small sample sizes relatively, and measures were not really always validated or even available for us. So where do we go from here? And that's where the NSA came in to help me work with this. So thank you. And much of the money we used with this, by the way, was for programming. So the methods, we actually built our own simulations. And we built several simulations ranging from things that are easy to very difficult based on feedback that we got from actual people who stutter. And everything that we did, this is for the engineers and computer scientists in the room, we used the Unity 3D software engine to create these simulations with the C# programming language. We used Oculus MetaQuest headsets, by the way, which range from $299 to $399. They're really quite reasonable today. We did that so I could send them home, and if people broke them, it was okay. And then we also monitored, we used some watches which monitor heart rate and all types of different biological functions. But we really chose heart rate because that's the biological measure that seems to be related most to anxiety. Recorded everything with these little GoPro cameras, and it's easy to analyze with it. So we built several simulations already, and this is just a range of the ones that we built ourselves. Talking to a dog, meeting a person one-to-one, introducing yourself in a classroom, introducing yourself to a stranger on the streets, actually giving a classroom presentation on stuttering. As you can imagine, that was one of the most difficult rated simulations that we built. Different work environments, both quiet and noisy with distractions, talking on the telephone, and some other ones as well. And this is just a flat screen production of what it looks like. But remember, in 3D, you can look all the way around you. So it's ordering in a restaurant and there's people behind you, around you, talking to and interrupting you, or a classroom setting that looks like this. There's a teacher in there as well. And here's where you actually make the production. You got your little PowerPoint screen there too. And you use hand controls as well, so you can actually advance the screen and interact as you go through. So we really wanted to test them. That was really our goal, to see if this does make an impact or not. So we used the research paradigm where we did a pre-test, post-test measure. And we did that for both for how much stuttering occurred, and again, whether that's really the important variable or not, we measured that. We also measured their heart rate that was related to anxiety. When they were done, we interviewed them using semi-structured interviews and then did a thematic analysis to come up with the major themes. We gave them something which is called the presence questionnaire to see how immersed the person is and how real they feel it is. And then for experiment 3 that I'm going to report on today, we actually paired those simulations with the real life comparison that actually went into that situation. And we did some individual case studies and statistical analysis as well. So I'm going to go quickly over 3 studies. The first one was the impact of VR on stuttering and heart rate for kids who stutter. We had 7 children who stutter as part of this study. Their ages were 8 to 14, and we pre-tested them in one virtual reality environment. And that was where they were introducing themselves in the classroom. We sent them home for 2 weeks. We asked them to practice for 5 minutes per day, 5 days a week. And they came back and we did the post-test in that same virtual reality environment. And the results showed a dramatic change in the percentage of stuttered syllables when they were in that setting, okay? And this did reach the level of statistical significance. And their heart rate also changed dramatically within this two-week period. And it decreased once again where it reached statistical significance. The presence questionnaire showed that the children were immersed in the setting and felt it was real. And then we analyzed their interviews afterwards, and we came up with 3 major themes that were fun, realistic, and one that had some sub-themes for it that talked about the good speech and the practice they got from it. Because of the time constraints, I'm just going to pick up on a few of these over here. I want to talk about this one over here where they talked about it being good theme, good practice. One participant said, like, I didn't really stutter a lot, so I haven't been stuttering a lot since I finished it. Now, whether that's true or not, that was certainly his perception. And I like this one too about more confidence. And when he was talking about confidence, he said it gave me more of it. So I went and I performed in front of a class for 2 weeks, and I was pretty confident. It gives you confidence. So when we look at those results of that first study, we came to the clinical implication that it's a valid strategy for stuttering intervention, and it decreases both stuttering and heart rate. And one thing that was really important that the parents reported on is that kids practiced more than they were supposed to. They practiced every day instead of just 5 days, and they never had to be reminded. So it leads us to, well, what are we going to do? More simulations, a different age group, and maybe more participants as well. So we then altered them, and we used these with older individuals who stuttered. And this time we used clients who were over the age of 21. And we put them in the pre-test, this time in 3 different virtual reality environments. One was easy, one was moderate, one was difficult. The easy one was a quiet work environment. The moderate was a fast food restaurant. The difficult one was a noisy environment with lots of interruptions and lots of noise. We asked them to practice just 5 minutes per day, but this time they were older, so we only asked them to practice for 1 week. Came back and tested them in those same VR environments. Once again, I think the results are very promising. We got a statistically significant change in stuttering from the pre-test to the post-test. We also got a statistically significant change in the heart rate from pre-test to post-test as well. Presence questionnaire showed that the participants were immersed and they felt like it was real. And then we once again interviewed these people and did thematic analysis. And we came up with 3 themes: that it was realistic, it was helpful, and it helped them make some change. Okay. Just a few quotes from that in terms of helpful, one that's bolded there. And I like this. These were older individuals. They said, I really appreciated the independence in speech practice. I like that one a lot. And then in terms of change, the one that's bolded on the bottom is, I felt the change in my speech difficulty and the emotional distress. So they at least report that they're kind of feeling some of the things that we have with the subjective data. So once again, we found out that it seems to be a valid strategy for stuttering for both adolescents and adults, and it decreases stuttering and it also decreases the heart rate as well. So we thought, what needs to come next? Our plan with the NSA, we promised we would do this, and we did. We came up with more simulations, more participants, and we also did a post-study, a post-test study with a paired real-life environment with simulations. So these are the results of study number 3. 6 adolescents who stutter that I'm reporting right now. We actually have 9, so we have even more data to go with it. These were ages 10 to 19. We pre-tested them this time in 6 different virtual reality environments. 2 easy, 2 moderate, 2 difficult. The easy ones were one-to-one introduction, talking to a dog. The moderates were a classroom introduction and ordering fast food. And the difficult ones were talking on the phone, which actually did surprise me, but that's what they said, and classroom presentation on stuttering, which didn't surprise me. That would be the most difficult. We send them home with the VR units, ask them to practice for 2 weeks, about 10 minutes a day, because there were 6 simulations. We brought them back and did the post-test in the VR environment, and also walked them into those real environments that were paired with the simulations. So they actually did go to the fast food restaurant. They actually did go into a classroom and introduce themselves. Okay, so here's what the results look like. The percentage of stuttered syllables from pre to the post changed, and to the real life setting changed as well. But with that, because there's 3 groups, you have to run an analysis of variance, and it did not, unfortunately, reach statistical significance. Same thing with the heart rate. It didn't reach statistical significance, but actually kind of moved in the opposite direction. Presence questionnaire showed that the participants were immersed and they felt like it was real. And then the qualitative analysis and the thematic analysis, this time they were all over the place. The major themes had to do with the equipment. Another thing we called in public, because they talked about what it was like in the real situation, in the VR, what happened, how they felt about the ER. And then they actually talked about therapeutic impacts. I'm just going to show you a few of these. The equipment one is less important, I think, but the in public thing, where they're in the real life situation, I highlighted one in a different color to you. It says, like when I'm at school, like when you're in public places, like I have to order stuff. It gets you kind of like nervous. So I mean, it causes me to stutter. So they felt like that real life situation was part of their cause. And once again, these are just their opinions and feelings. In VR, one of the participants said this. He said, I thought it was interesting to be able to kind of test myself in those situations. I would say it didn't take a lot of my time, so it was really nice. I like that, okay? The therapeutic effect, I'll just read one of the quotes here too, and it's in a different color. It says, well, like I've gotten better, like when speaking in front of people, like things where like I kind of stuttered good. So I like this, and I want you to know and emphasize that we did not use any particular therapeutic technique with this. We send them off and said, just be the best communicator you can. Because quite honestly, one of my co-investigators wanted to know, what's the technique? What's the technique? You know, this really wasn't about technique. It really was about practice, okay? And specifically, I think that when we look at the clinical and the research implications from this, I think that VR now, I can't say that it's really an effective therapy, but I think it's a great adjunct to traditional therapies rather than an individual method. And I think because of it is really immersion. They get lots of practice where they can't in lots of situations. It decreased stuttering, but the transfer didn't really carry over. And I want to kind of look at just a couple cases to maybe show you what I'm talking about here. Here's some of the conglomerate data that has to do with stuttering. And if you look at almost every one of these cases, from the pre-test to the post-test in the VR, they do actually decrease, almost every one of them, except for this outlier over here, who I think only did it because he wanted to get the money that we offered as a compensation for doing this, but that's okay. But if you look closer at this and we look at one of these cases, this seems to be the trend that is happening, is that you get a dramatic change from the pre-test to the post-test. It's good practice. It doesn't carry over quite as well into the real life setting, but if you look at the change that takes place from the pre-test to the real life settings, we're still making those changes. So if we're to kind of summarize and conclude on this too, I think that VR has been shown to be a really viable tool for stuttering therapy, but really as an adjunct. And as I said, I think it's really immersive therapy in nature, lots of practice. So there's more and more opportunities to use this. And if anybody's familiar with the work that Gareth does with VR, I think that that's another opportunity that's coming through, but they haven't been tested yet. So as I said, 2 of these have been published already, 2 are in review, and they show these changes. If you have any questions, there's my information there and just a small list of references at the end. So thank you very much. And I missed by 2 minutes. I went over. Sorry to the next group. Thank you. Next group is up.
All right. Ginger, are you here?
Yes, I'm here.
Okay, sounds good. All right. Well, we've arrived at our last talk. So, I just wanted to, yeah, just give a quick shout out to the NSA for hosting this during National Stuttering Acceptance Week. It's such a great week to do this. And so today, or this evening, Ginger and I are going to be sharing the results of some of our work looking at how SLPs can best support adolescents as they transition to life after high school. And what a perfect full circle moment where we started with Cody's presentation on labor market and stuff. And so this is totally in line with that. We are, working on how to really support teens as they get ready for the real world, and that includes work life as well. All right, so yeah, so we received this award in 2022, and it was Ginger's idea, and she was PI in the project and kind of brought me along for the ride, and it's been such a rewarding process. And so this was an ARC award, limited edition ARC award. And so our project has 3 aims. The first one is that we wanted to understand how high school-based SLPs are currently creating their individualized transition plans for high schoolers who stutter, because we suspect that perhaps they're not as holistic and supportive as they could be. So we've collected our all of our data from the national survey. We presented it at ASHA a couple years ago, and we're currently in the final stages of our manuscript for that. Our second aim was to develop and distribute individualized transition plan materials to support SLPs in their transition planning. And so this paper actually just got posted online last week, so it's hot off the press. And so that is complete. And so that's what we're really going to focus our talk on today, summarizing this second aim. And our third aim is to really support training for pre-service SLP. So thinking about grad students. What are grad students learning about how to support high schoolers who stutter? And if there's anything that we can do to really like ramp up their training so they feel well equipped to support this population. And we were so grateful that Sarah McIntyre, who hosts the Stuttering Foundation podcast, invited us actually to come on and do an SFA podcast episode about this work. So we actually joined forces with Sarah and the SFA podcast. So now we are collecting data from grad students who take a pre-test about their knowledge of transition planning for students who stutter. Then they listen to the podcast and then they do a post-test. And so we are actively collecting data for this. So like Haley, if anyone has any grad students or access to a grad program, like we are looking for more grad programs to participate in that. But yeah, we are mostly going to be focusing on our aim 2 for this evening. Now I hand it over to Ginger.
Oh, okay, sure. Can you advance this slide? Okay, thank you. All right, so I think we're all, in this space, we're all pretty well aware of those clinical challenges of supporting adolescents who stutter. They are a very unique population, really quite different from many of our other clients that we have in the schools with whom we work. And without effective support, we know that they're at risk for some adverse impacts such as anxiety, such as underemployment, and just overall reduced quality of life. And furthermore, most students who stutter don't receive specialized stuttering therapy outside of school. They're, really dependent on the services they get within the school. And it's often the only service that they do receive. So if we think about some of our other clients that we see in the schools, if you have a language disorder, for example, more garden variety language disorder, you may be getting support from an SLP, but maybe also the school psychologist, or maybe also a reading specialist or literacy coach, or, if you have dysgraphia, maybe the occupational therapist is also involved. So you have a team working together to help develop plans for these students. With many students who stutter, speech, we call them the speech only kids, our speech only students. And so that's a pretty heavy lift for school-based therapists, speech therapists, particularly when we know that there is a low confidence reported among most school-based SLPs when it comes to working with students who stutter. So this is what really inspired this work. This is really a critical inflection point, and how can we help high school based speech therapists support our students who stutter as they make that transition to adulthood, especially whenever you think about all those skills that are needed to successfully transition to adulthood. We know that that's difficult under the best of circumstances. Adolescence is hard. Becoming an adult is hard. And sorry, I've got a little pop-up I need to close so I can read this. Okay. And so they need those skills to navigate those environments, particularly when they are not really stutter friendly, or maybe even discriminatory, whether that's out of ignorance, not being well acquainted, or if it's just an outright prejudice. So we need to equip our students before they get out into, that life after school. So starting with these individualized transition plans, any student who has an individualized education plan, an IEP, by the time they turn 16 years old, they also must have an individualized transition plan as part of that IEP. And that's a specific plan that helps prepare them for how are they going to, become employed. How are they going to live independently if that's how they choose to live? How are they going to function in post-secondary education or training situations? Because that includes vocational training, associate's degrees, four-year college, whatever it may be. But there are supports in place. However, one of the biggest issues that a lot of students face is that when they're in the schools, they are shepherded through the system. They have the teachers, they have the therapists who are telling them, this is what you need to do. This is how I'm going to support you. And then there's a very sudden drop off after they graduate. They have to be their own advocate. And oftentimes people are unaware of services that are available to them. So, it makes it difficult. And then even when there are services available, one, you have to know about them, but two, you have to self-disclose and also kind of, be proactive in making sure that your, rights are not being violated. So, so getting those accommodations when needed, the services when needed, becomes a big issue. And unfortunately, there really are no established best practices for SLPs when it comes to working with students who stutter and preparing them for that transition process. There are lots of transition manuals, lots of, we've probably seen lots of goal banks and things like school services, but they are really not designed for this population. So we almost have this outlier population that we can't ignore. We really need to address this. So given the possibility for those negative post-secondary outcomes, it's imperative that post-secondary planning services for students who stutter really target holistic and adaptive coping strategies. And that's what Naomi and I hope to address with this study.
All right, so what we did was we recruited a few different groups of participants to participate in some focus groups. So we had 2 focus groups that were a blend of current high schoolers who stutter and recent high school grads who stutter, so up to age 24. And then we also hosted 2 focus groups with a blend of parents of adolescents who stutter and high school-based SLPs. And at those focus groups, we had our interview guide. And so just to kind of introduce you to some of the questions we asked, we worked through each of those 3 domains of transition planning kind of one by one and explored them. So we started with the first one. So when you think about next steps in education or vocational training after high school, what are your primary concerns for yourself? Or for the parent and SLP group, we asked about your child or student. Then we also asked questions like, what skills do you think young adults need to effectively navigate post-secondary education? And then also recognizing that it's not just an individual burden, right? That there are environmental things that can either hinder or facilitate a productive experience. So we asked what types of structures are needed to help young adults who stutter effectively navigate that space. And so we explored each of those 3 domains, so post-secondary education, employment, and independent living. We qualitatively analyzed our data, and then once we generated our themes from the focus groups, we did send those themes out to all the participants to check how well they think those themes reflected what was shared in the focus group. And those feedbacks was integrated into our themes. So I'm just going to quickly kind of overview our results. And again, these are organized by those 3 domains. So the first one is post-secondary education and training. Our participants talked about the importance of educating instructors and peers about stuttering through disclosure and other types of educational and informational exchanges. Our participants also talked about accommodations, but this was kind of a mixed bag. We did have a lot of adolescents who stutter that talked about how they really didn't want to be viewed as any different than their peers who don't stutter. They didn't want to be treated differently. And so because of that, they didn't want to seek accommodations. Whereas other teams, and especially the parents and SLPs, were all about the accommodations, right? Asking for more time for presentations, adjusting the grading rubric so that they wouldn't involve like fluency or clarity, and other things like that. So it was kind of a mixed bag. So instead of saying like, pursue accommodations, we just said consider accommodations so that there's a conversation with teens about that. And the last theme for this domain was to develop coping strategies for stressful classroom interactions. The teens who stutter mostly talked about the stress of orally presenting or participating in class, whereas the parents and SLPs were mostly concerned about negative peer interactions and any micro or macro aggressions that they would experience from others. So going into our next domain of post-secondary employment, so this is the workforce. The first thing that came up was, again, the importance of educating employers and coworkers about stuttering. They also talked about, there was a lot of discussion about how stuttering impacted their career choices. The parents and SLPs were really adamant that stuttering should not impact their career choices, that these young people who stutter are capable of anything and they should go for whatever they want to go for. But the adolescents who stutter had revealed to us in the focus groups that that stuttering was really impacting their career choices. And so this really goes along with Cody's past research and Rod Gobble's past research about role entrapment and how that can oftentimes stems from people who stutter themselves. Preparing for job interviews was a really big one, like the importance of having SLPs run like mock job interviews and really preparing teens for how to how to kind of handle that really stressful first impression. Understanding workplace rights and co-creating an accessible work environment. So the teens who stutter really didn't know that stuttering is considered a protected disability. And so that's an important conversation that SLPs and parents can be having with their teens who stutter. Even if teens who stutter don't identify as having a disability or being disabled, they still need to know that stuttering is a protected disability and they can seek accommodations in the workplace and they are protected if they do experience discrimination. And then going into our last domain of independent living, again, we still are educating others about stuttering. So this is not just for instructors or for employers, but also for people that you call on the phone or people that you encounter at the store, at the restaurant. So educating others and disclosing. Preparing for independence and activities of daily living. A lot of parents were concerned, like, how is their teen going to navigate their doctor's appointments on their own? The teens didn't realize they have to like call to start their utilities for places. So just kind of helping teens get ready for all those, activities of daily living that they're going to have to encounter, just so that they know what to expect. Developing coping strategies for stressful social interactions. We heard a lot about just the importance of like stepping into one's own as a person who stutters and really working hard to integrate stuttering into your identity, and how impactful that can be as a person who's navigating the world independently. And then seeking support, belonging, and mentorship opportunities. So the importance of connecting with other people who stutter, staying connected with extracurricular groups and things like that.
Okay. And so this is the discussion guide that resulted from these findings. And this is really designed to be a way to broach these topics with the students before they graduate and get them to start thinking about things that might be impacting them later on down the road so that we can prepare them. We still have time while they're in high school to prepare them. And as you probably noticed, actually, Naomi, would you mind rewinding just a little bit? And yeah, we can just stop right there for a moment.
Yeah.
Thank you. It gives discussion prompts on the left side and some potential observations on the right column. Now, it's not an exhaustive list. They're just sort of those greatest hits that we often see a lot of times when we're working with our teens. And it's separated into education and vocational training is the first one. Then it's also employment and then also independent living. But if you find yourself ticking any of these boxes, like these observations, let's see, for example, what kinds of jobs or careers are you considering? Well, if the student, for example, mentions jobs that only require little to no speaking, that's a good place to start because maybe that's the kind of job they actually want, but we want to find out, are you self-limiting? Is it more of that role entrapment? Because that could be a good talking point. And then you can start developing some transition goals based on this information. Great ones for the ADA because they have to be familiar with what those rights are. They have to advocate for those rights. And also just below that, I know it's a little tricky because you're trying to play the video.
That's okay.
But the Job Accommodations Network, it's kind of down there at the bottom of the page. It's really interesting. Most students have never heard of this before, and it is a wonderful resource. If you ever feel like, what can I do? Like, I feel like there's a problem here, but I don't even know where to start. I don't know who to talk to. That is a great jumping off point. Go to the Job Accommodations Network at askjan.org. And it even has a section on employees who stutter. And it gives some great examples of some accommodations that are very reasonable in most workplaces. So it's not like they even have to start from scratch. There's a lot already there. And then finally, independent living. It was pretty interesting to me that this engulfed a lot of what the responses we observed in those focus groups, where, you know, there's a lot of wanting to connect. There's a lot of want to be accepted by peers, maybe even joining faith-based groups or whatever it may be. But you can think about, like, how do you envision yourself after high school? And if you can start to see some of those responses, maybe they are uncertain how to seek support. Maybe they demonstrate limited ability to identify communities they wish to be a part of. That's a great jumping off point as well, as far as you can get the conversation going. That can be a transition goal that they can work on. And I could go on forever about that. So
Yeah. I do want to just make
Okay.
a shout out that we do have info about, I know the NSA has lots of resources for workplace things, and so that's also linked here on the discussion guide as well.
Good point. Yes, absolutely. And so, you know, takeaways, the common thread of cultivating a proactive stance. And I think everybody was on board with that, and like in all the focus groups, the current teenagers, the recent graduates, as well as the parents and the SLPs were all like, yes, we need to be working on this before we launch them out of the nest, you know, and prepare them for that. Importance of education, whether it's educating oneself or educating others. Openness, a lot of that had to do with self-disclosure, as well as self-advocacy. And support, you know, remaining connected to your peer groups, you know, joining maybe a support group if needed. And exploring stuttering as an identity and disability from a strengths-based stance. That became a very big one. I was actually a bit surprised how much conversation there was around identity and whether or not you considered yourself to have a disability, because I think that, you know, can be a little bit prickly. Maybe you don't view it as a disability, which is great, but you must also disclose it as a, quote, disability to an employer to receive accommodation. So it does feel like a little bit of a double-edged sword. So having those talks can be really helpful. And then it takes two to prevent and address discrimination. So I love that aspect of it too, that, like, you know, we're constantly educating others whenever these things happen. Should they happen, maybe proactively, they're not happening yet. But being sure that you're not just putting everything onto the student, but also getting them to be proactive with their environment. And like, I can't remember who said it now, some great quote here, I made my employment
Cody's, yeah.
stutter friendly. I don't remember what you said, Cody.
Yeah, that was right. So
Okay.
All right. Well, thank you so much, everyone.
Yes, thank you.
Sorry, we went a little bit long.
No problem at all. Wow, you all are doing such great work. And I really hope that all of this great information is able to be disseminated to SLPs. So awesome. We have a couple minutes for questions. If there are any questions, you can post them in the chat, or you can feel free to raise your hand, and we will call on you.
Well, I can respond to one of the questions in the chat. As Naomi mentioned, our article was just published last week in speech and language services in the schools, and the discussion prompts are there as supplemental material. And I believe that the discussion guide is also being posted on the NSA website.
Any questions before we end? Just wanted to give everybody a chance to ask anything. I think all the questions in the chat have been answered, so I won't go through those. All right. Well, I want to thank our 6 presenters so much for the time and the effort, and for really doing such great work that, you know, has real clinical implications, because that I feel like is such a core part of what NSA does, and we want to make sure that this research is heard and is used. So thank you. Angela, do you want to add anything?
Yes, thank you all so much for being here. Thank you to our presenters. I wanted to do a quick little advertisement. If you're interested in funding, if you're a student, or also if you're a PhD trained faculty member who's doing research in stuttering, please visit our website. If you go to the research tab, you can find all the details about the Graduate Student Research Award and also the Case Research Grant, which is due July 15th. So there's still time for that if you're interested. You can email me at angela@westutter.org if you have any questions. Thank you all so much for being here. And thank you again, Courtney, for pulling this together. This is phenomenal.